Welcome to UMCC Medical Consultants Connectors, where your health matters to us. An abdominal hernia happens when there's a weak spot in your belly wall. This weak spot can develop for various reasons, such as heavy lifting, persistent coughing, or even due to a previous surgical incision. Imagine a weak spot in a tire. Just like how a tire bulges out where it's weak, your abdominal wall can do the same. The inner lining of your belly can push through this weak spot. This creates a bulge, which is the hernia itself. This bulge can be more noticeable when you stand up, bend down, or cough. This bulge might be painful, especially when you move or lift something heavy. The pain can range from a dull ache to a sharp, intense discomfort. It's important to know about hernias so you can get help if you need it. Hernias are common, and understanding them can help you recognize the symptoms early. They can happen to anyone, regardless of lifestyle or fitness level. But they're more common in men. Men are more likely to develop inguinal hernias due to the natural weakness in the groin area. They can happen at any age, from infants to the elderly. But they're more common as we get older. This is because our muscles naturally weaken over time, making it easier for a hernia to form. Regular exercise and maintaining a healthy weight can help reduce the risk. There are different types of abdominal hernias. Each type occurs in a different part of the abdomen. The type depends on where the weakness is. For example, an inguinal hernia occurs in the groin area while an umbilical hernia occurs near the belly button. Some common types are inguinal, umbilical, and incisional hernias. Each has its own specific characteristics and risk factors. Knowing the type of hernia you have can help in determining the best treatment options. Why do hernias happen? There are many reasons. Sometimes a hernia is present at birth. This is called a congenital hernia. Other times, hernias develop later in life. Several things can weaken your abdominal wall. These include aging, previous surgery, and chronic coughing. Heavy lifting can also put too much pressure on your belly. This pressure can cause a hernia to form. Other factors that can increase your risk include obesity, pregnancy, and constipation. These conditions all put extra strain on your abdominal muscles. It's important to understand these risk factors. This knowledge can help you take steps to prevent hernias. How do you know if you have a hernia? The most common sign is a bulge in your groin or belly button area. This bulge may be more noticeable when you stand up, cough, or strain. You might also feel pain or discomfort in the area of the bulge. This pain might worsen with activity. Some people feel a burning or aching sensation. Others describe it as a heavy or dragging feeling. If you notice any of these symptoms, see your doctor. They can examine you and determine if you have a hernia. Early diagnosis and treatment are important. This can help prevent complications. Section 4. Diagnosis and treatment options. Diagnosing a hernia usually starts with a physical exam. Your doctor will begin by asking about your symptoms and medical history. During the physical exam, your doctor will examine the area for a bulge, which is a common sign of a hernia. They might ask you to cough or strain, as this can make the hernia more noticeable. This helps make the hernia more visible and easier to diagnose. Sometimes your doctor might order imaging tests to get a clearer picture. These tests, such as an ultrasound or a CT scan, can help them see the hernia more clearly and determine its size and location. An ultrasound uses sound waves to create images of the inside of your body, providing a non-invasive way to look at the hernia. A CT scan, on the other hand, uses X-rays to create detailed pictures, offering a more comprehensive view. The treatment for a hernia depends on its size and severity, as well as your overall health and preferences. Small, painless hernias might not require immediate treatment and can often be managed with lifestyle changes. In such cases, your doctor might recommend watchful waiting, which means monitoring the hernia for any changes or symptoms. Regular follow-up visits will be scheduled to ensure the hernia is not getting worse. Larger hernias, or those causing symptoms, usually require surgery to prevent complications. Surgery involves pushing the bulge back into place and repairing the weak spot in the abdominal wall. This can be done with traditional open surgery, which involves a larger incision, or minimally invasive laparoscopic surgery, which uses smaller incisions and specialized instruments. Recovery times and outcomes can vary, but many patients experience significant relief from symptoms after surgery. Post-surgery care is crucial, and your doctor will provide detailed instructions to ensure a smooth recovery. With proper treatment and care, most people can return to their normal activities and enjoy a better quality of life. Section 5. Prevention and lifestyle modifications. While not all hernias are preventable, there are things you can do to reduce your risk. Making small but significant changes in your daily routine can have a big impact on your overall health and well-being. Maintaining a healthy weight is crucial. Excess weight can lead to increased pressure on your abdominal wall, making you more susceptible to hernias. Excess weight puts extra pressure on your abdomen. This pressure can weaken the muscles and tissues, creating an environment where hernias are more likely to develop. Practicing proper lifting techniques is also essential. Incorrect lifting can cause sudden spikes in abdominal pressure, leading to hernias. Lift with your legs, not your back. This technique helps distribute the weight more evenly and reduces the strain on your abdominal muscles. And avoid lifting objects that are too heavy for you. Knowing your limits can prevent unnecessary strain and potential injury. If you have a job that requires heavy lifting, use proper equipment and take frequent breaks. This can help manage the physical demands of your job and protect your body. Eating a high-fiber diet can prevent constipation, which strains your abdominal muscles. Fiber helps keep your digestive system running smoothly, reducing the risk of hernia-related complications. Staying hydrated is also important. Proper hydration supports overall bodily functions and can help maintain the elasticity and strength of your muscles. And if you smoke, quitting is one of the best things you can do for your overall health, including your hernia risk. Smoking weakens connective tissues, making you more prone to hernias. Remember, taking care of your body can go a long way in preventing hernias. Regular exercise, a balanced diet, and mindful habits are key components of a healthy lifestyle. UMCC, your ultimate medical consultant connectors.